Okay, so next we're going to hear about what's coming up. And I think, Claire, you're up next with the COVID-19 vaccine workflow.
Thank you, Sam. So we have designed a reference app to demonstrate the capabilities of CHT in supporting COVID-19 vaccine workflows. So what the emphasis here is just to equip the CHWs with information so that they can also encourage patients to go for vaccination. For our design, the language, we used language and education messages. We used the WHO recommendations on COVID-19 vaccination. So I'm going to do a short demo on how the workflow looks like. So I'm going to share my screen. So I'm going to make it look a bit smaller. So we have just a moment. So we have the normal the normal landing, the people's tab, and then if we come here to Jude or Cod's household, we have a number of people here. So we, for example, take the Joska Emily household, sorry, person. Then we look at we go to the new action. So we have this form here, which is COVID vaccine registration. The first thing, it provides information to the CHW on the benefits of vaccines. And then the first question is, have you received COVID-19 vaccine? So just to start off, before I continue with the demo, we have three scenarios. One is for those people who have been fully vaccinated. The second one is for those who are partially vaccinated. And the third one is for those people who have not been vaccinated at all. So I'll start with the scenario. I do a quick walkthrough here. So if the person says they have received the vaccine, it takes them to this information. We'd like to know which type of vaccine they took. So currently, this is when we were doing our design, the concept of mixing of vaccines was not yet there. But since these are placeholder, this can be opened up to a multi-select question so that people can, the CHW can pick all the vaccines that the client has received. But for now, for our demo now, I'll just pick one of the vaccines here. We say next. And then we ask whether they have received all the eligible vaccines doses. We say yes. And then we congratulate the person, and then they continue protecting themselves. Our second scenario, go back here and say the person has been vaccinated. They have received the vaccine, or they have received one of the vaccines. But when we come here, they have not received all the eligible vaccines. Sorry, doses. So when that when we click on no, we then ask why is the vaccination status of the person is not up to date. So one of the reasons, it could be they have an upcoming appointment. The other one, it could be they have a missed appointment. And another one, it could be there is an availability of vaccines, and it could be others. So I'll focus on these two. They have an upcoming appointment. So the CHW gets a note to advise the patient to continue protecting themselves and wear masks, social distancing, and washing hands. And if they have an next appointment date available, we can put in the date that this date will trigger the COVID vaccine follow-up task. And the CHW can be able to go back to the household and remind the patient to go for their appointment. If it's not available, we encourage the patient. There are those who don't even know their next appointment date, but they know they should be going for another dose. So the CHW's work is to encourage the patient to go to the health facility for vaccination follow-up. I go back to this missed appointment because we could be having somebody who has missed their appointment. So the CHW is encourages the patient to complete their vaccination and to reduce chances of getting infected. So that's that's our second scenario. I'll go back here uh, to the third scenario whereby the person has not been vaccinated at all. So we say next. The question, the CHW is able to ask the person whether they would like to receive their COVID vaccine. So we go with the first scenario here, which is yes. The CHW is given a note to refer the patient to the health facility, and then they are given a chance to say the date they would like to come back and follow up with the patient. And this date again, it gives us, if we input the date, which can't be in the future, it gives us a COVID vaccine referral follow-up task. Then if we come back here and say, would you like to receive vaccine, and the patient says no, we ask them to give us the reason why they wish not to be vaccinated. And then whenever they give us a reason, there's an education message that the CHW can give to the patient. So if they give out this message and the patient consents to go for vaccination, we have this question that the CHW completes. They say that the patient has accepted to be vaccinated, and then that means they should be referred to the health facility. If they say no, then we encourage the CHW tells the patient to reach out to them in case they change their mind, and they should continue following up on all the laid down protocols. So I'll be going back here. We also have a few targets. We have gone some.
Sorry, I'm just keeping an eye on time, and if hopefully this is the last one, and then we'll go back to the presentation so that we keep the intended time for questions. Thank you. Just proceed.
Okay, so for targets, we have a number. We just have few targets here that we added. And since we continue COVID-19, everything in terms of protocols, policies, and vaccines, this might change with time, but we have provided like a placeholder, and community members or anyone who might be interested in this reference app, they can edit, or everything here is configurable to suit their needs. So that marks the end of this demo. Should I continue with the other one?
I'll go ahead and share my screen. For the next part, we could just mention or talk about what you're doing, and then move on to the product updates.
Cool. Thank you, Sam. So we have also received feedback that users are having difficulties whenever there's an upgrade and their UI changes. So for that, we are at the moment we are testing a concept whereby we have in-app upgrade cards. So the CHW go in and they receive an update that there are some changes, and then they go through the upgrade cards. It has information, and for your information, they are all configurable also to suit the needs at hand. And then whenever they finish the card, they close it, and then they are able to say whether they have understood the content, and if they have not, they can contact their supervisor. So if they have understood, then they can continue with the rest of the work that they intended to do, to work on the app. So Sam, that is all from me. Thank you.
All right, thank you so much. Sorry for cutting you short. Just keeping time for questions. Craig?
Thanks, Sam. This should be a quicker section so we can catch up. So the 3.14 release, which as you can see here, is we're looking at mid-February for now. So we recently cut that release, so now we're at a point of testing it before we can put it out for everybody. As you'll be able to follow up in the release notes on this, there are a lot of bug fixes in there. So again, the question, the latter. All right, a lot of bug fixes in there. As usual, you'll be able to see all of this in our changelog when we put the release out in the release notes. There are a couple other changes we'll look at here. So there are some changes for syncing the UI. We had some feedback of when you're doing a sync, then there's no feedback on the screen to show you that. So there's a screenshot of that in just a second, or a small video for it. And then we had some feedback about tab labels on small screens where, if you go to the next slide, please, Sam, we'll see that one. Where I think people had been going into Android settings as a way to fool the system into showing that. So that's no longer necessary. Now you'll get tab labels without having to jump through into developer settings and get to that. And actually, I realized I missed one point, Sam, if you would please go back one slide. At the bottom of here, it talks about the Enketo upgrade. On the last call, we had talked about that as being part of the 3.14 release. We chose to move it into the 4.0 release. And to do that, it goes around some changes that happened in Enketo that we're upgrading to. And those changes are around ODK compatibility, which is important to us, and we want to be ODK compatible. But as those changes can cause app changes, in this case, it's a very minor one, but it was more important for us to still get those changes and still remain ODK compatible, but move it to the 4.0 release and not have it be in a minor release. So that's why you'll see that that change is not coming yet and will be in the 4.0 release. Okay, if you would go forward and one more slide, please. So this is a video that our testing team had put together, but I don't see a play button or anything. Oh, there it goes. Thank you, Sam. So the part to look at there is, as the syncing happens, you get some feedback on the screen of what's going on now. And there are a few different cases here for if it succeeds, if it fails, letting people know what's going on. And in the fail case, you have a retry option. Oh, I see a question from Mohini about tab labels. And the tab labels are typically there, but on smaller sizes, they're not. Oh, thank you, Anthony. I see the answer. All right. I think that's it. The other video is probably just about done. All right, there we go. So the next up was CHT 4.0. And I see Diana and Josh, I know one of you was going to speak to this, but looks like both of you made it. So who's talking today?
I think I am.
Cool.
If that's okay with everybody. Hello, I'm Diana. I'm having some technical difficulties and I cannot see anyone or anything. So if somebody wants to point something out, please do it with your voice or in the chat. So for 4.0, last time we discussed scalability. If anybody has any questions about scalability, please ask, but I'm not going to reiterate on something that's already been discussed, but I'm going to go into some more technical details about what we're doing. So right now, the CHT, either Medic hosted or self-hosted, is launched on a platform which is called MedicOS, which is a small distro of Linux, which we maintain. This makes upgrades of the third-party software that we use pretty difficult because we don't have a very streamlined automatical process that does this across all of our deployments. So what we're doing is we're shifting away from that completely and switching to using Docker and Docker Compose. This is part of our commitment to stay up to date with third-party software that we use in our stack. We started with Angular last year, and we are continuing with using Docker instead of MedicOS and trying to keep our plans is to also upgrade the version of CouchDB, but that will probably come into a 4.1 or a future minor. There are a lot of advantages to switching to Docker and Docker Compose. I'm going to list some of them. One of the advantages is that we are going to have full control over what node version, for example, we are running. With macOS, we were stuck on node version 8, which is very old and not supported. We are completely removing that. We're going to be on the latest LTS and have no problems with upgrading and keeping up to date using this infrastructure. Other major advantages is that once we fully mature this platform, we are going to be able to add more containers as things progress. For example, we will probably be able to include a container for a dashboard or a caching service, or possibilities are endless. But the idea is that every Medic application or process is going to have its own container dedicated. That each container is going to be hooked up into monitoring, which is also a very big advantage for the reliability of our deployments. With macOS, there was no transparency over which process is using too much memory and things like that. So with this, monitoring will be per process, and we will have not just debugging, but a lot more information into server health. Another big advantage is that by using popular tools, technical partners will have a much easier time onboarding support staff. And for us as well, it's a big advantage because anybody can pick things up and read a tutorial about. We also have community support and all the goodies that come with that. Another advantage is that we are going to build release images for our software for every release, actually every branch. So we're not going to be in the possibility where right now, if you want to install CHT as a self-hosted, you're going to download the image for 3.9 and going to have to upgrade to 3.13. That will no longer be the case. We will be publishing images for every branch, actually, so people can install branches and publish a Docker Compose file that can be used by anybody who wants to install the CHT. We are trying our best to keep our upgrade process as easy as it was before, so a one-click or rather two-click updates. We are going to need some help for that. It's going to be another in-house tool, which we are working for developing, but we are struggling, trying to keep that feature in. So upgrades are not going to require technical staff. Thank you.
Thank you, Diana. And now I'll just open it up to questions. We have about 10 minutes, and anyone who has a question they'd like to ask by voice, please feel free. And this is your opportunity. Or if there's anyone who'd like to respond to anything that's currently on the chat that hasn't been responded to. I don't know if Carol is still here.
I am. I responded to the 2 questions that I could. I just couldn't scroll fast enough if there was anything else. I also put the 3 links to our already published papers, and the other ones are still in press.
All right. And as people think about their questions, I'll just mention that we went through the feedback from the last call and posted some responses to those. One was improving test harness documentation. We raised an issue on GitHub about that, and we've been discussing it internally and are currently planning and working through that. We also have people working on more user-friendly reports and strengthening user account security features. And we will have presentations from different people on things like user account management coming in the next call or a few weeks from now. So again, even if it's not a question, if you have thanks, Mark, for that comment. Would you like to talk about that?
I just wanted to add that to what Deanna was talking about, because I think that, like, just putting into context, all that work has a lot of advantages internally, being able to, like, for tech debt, but also for large scale deployments, that is going to help all the deployments that are going at large scale to be maintained more easily, to be able to scale, and to be able to adapt to that. So just want to make sure to bring that back and see if folks had questions there. I see that Patrick had a question about timelines on 4.0. And I think probably Deanna is probably the best to respond to that as well.
We have discussed this internally. We are aiming for an end of Q1 2022, but it's not a set in stone deadline.
Cool, thanks. And Leah, are you still here? I know I cut your time, and there was something you wanted to mention about how the community can help you with the user testing that you are working on. Would you like to talk a bit more about that?
Yes, Sam, I can talk about it briefly. So, like I had mentioned, we are testing a concept of having enough upgrade cards that are configurable, and the CHWs can learn about the new changes on their own. So I want to, can I just present the?
Yes.
So this is how it might look like. It's just a prototype. So the CHW will receive a notification that there are some changes to the application. So they go in, they follow by clicking next as they read. So, like, for example, here there's a new change. We have added a floating action button. So they want to learn just an example of one of the concepts, an example of from the concept that we want to learn from. So they keep learning, and when they are sure that they have understood, they can go ahead and start using the application. If they are not sure that they have understood the changes, they can reach out to their supervisor. And this usability that we are doing, or rather usability testing we are doing with with users, we'll be publishing it, and the community members will be able to see the results. So I'm going to keep it as short as that. Thank you, Sam.
All right, thanks, Leah. And not to put you on the spot, but one other question on the COVID vaccine reference app is, if I, as a community member, would like to take that and use it or apply it in something that I'm doing, how would I go about that? I know the answer to this, but imagine a community member asking this. And anyone who's here can respond to that. You're on mute.
Oh, sorry. So I know it will be available to community members, so it will be public. But Sam and Mark, maybe you could help with the technical bit on how they can access it. Thank you. But it's fully configurable. The information there, it can be customized.
All right, and the link has been shared on the chat. And just a bit more about reference app. And it's related to the question that's on the chat about where to start from. The reference apps are a good place to start from, where you get a bit of what you may be wanting to build, and you can add more features to that or add more functionality to what's there. So we have some public repositories that contain that code, and someone can fork that repository or copy it and customize it as they please. So some of it is not ready to to be used as is, but you could make the required modifications. And yeah, so I see most of the questions, or I hope most of the questions have been answered, at least on chat. And curious if we can announce news.
I think Dixon had a question. We can allow Dixon to share the question, then we can take the conversation to the forum.
All right, yes. So in the 1 minute that's left, Dixon, welcome. And please feel free, even if you can't or you are not comfortable raising it right here, please connect with myself or Anthony. That's samuel@medic.org or Anthony@medic.org, and we will be channeling those questions to the right people and responding to you.
Okay.
So thank you. All right, go on.
I think the questions I had raised, I received answers, and I received a link on how to set up the CHT core on an offline server. One thing that is coming out is, supposing we set up on an offline server somewhere, how can we replicate that data to another server? Just in case we have an offline server somewhere sitting somewhere in a facility, and then we have a server sitting somewhere in the national data center. That's one. Then the other thing is, I still haven't gotten responses on how the Pi core was adding complexities to the network. It is a learning lesson that we might need to take, so that in case we follow that route in future, we know what we are preparing ourselves against. Then on the setting up of the local domains, were the local domains being set up on the Pi core because the Pi core has a DNS server, or are they being set up elsewhere? And also issuing SSL certificates against these local DNS names. How was it done? Thank you, and over back to you, Chair.
All right, thank you so much for those questions. Just before we start responding to them, anyone who has an extra 4 minutes or so, stick around. If you need to drop off, that's also fine. Thank you so much for joining, and we look forward to seeing you in the next one. So right now, I'll give an opportunity to anyone with responses to those questions. If you have a few minutes, stick around, please do, and let's have a discussion. Is Anthony or Leon from Palladium here?
Yeah, I'm here. So, okay. Yeah, thank you for that. So, maybe I can go from the first question about the how we did the registration of the certificate. So basically what we did, we procured an actual domain name, an actual certificate. We used GoDaddy. So we just procured the domain part, like let's say afiastart.org. Then we got the certificates. Once we got the certificates, when you go to the community, there are some instructions on how you can now like put them on the Pi-hole and also transfer the certificates, or in our case, we were using Nginx, transfer the certificates to Nginx as the web server and also put them on Pi-hole. So basically what Pi-hole does, you see if you, let's say you are using an online DNS server, it will try and resolve on the internet on, let's say, the facility.afiastart.org name. It will try and resolve on the internet. But if you have a local DNS server, it will help you, like once you've registered the domain name on the local DNS server, now Pi-hole being the case, it will now resolve locally and take you to the interface or the web page that is being redirected from the domain, from the setup that you've done. So the other question on the complexities that came up on the facility network. So as we said, our setup is quite unique. It's not a centralized setup. It's just it's more of distributed. So you get instances whereby you have the facility or the hospital has already they have their own network setup and their own infrastructure. Now you're introducing in a new thing that now takes over the functionalities of being the DNS server and being the DHCP server, whereby previously for the challenges that we faced is that now we had some, like, for instance, you get two applications, let's say if they were using a router or a switch to manage the IP addresses. Again, we have the Pi-hole coming in to manage the IP addresses. So we just have some complexities like those. But basically what we did, from the setup that we've done, Pi-hole is now managing the network, acting as the DHCP server and also the DNS server. So maybe the final question was about syncing data from an offline to an online instance. Really that we have not yet tried. So I don't know, maybe that is something that we could want to link up with the community and see if it can work. So that's all from me. I don't know if that's enough or if there's any member from Palladium to chime in. Thank you.
All right, thank you so much for those responses. Did that answer your question, Dixon? Your questions?
Yeah, it does answer my questions. But maybe one of the things they should have done when they're setting up Pi-hole was to disable the network devices issuing IP addresses and leave Pi-hole to be the only source of IP addresses on the network. Because when you have more than one device issuing IP addresses on the network, you bring about conflicts.
Yeah.
That's one of the things that I picked up. Otherwise, the rest of the responses have been well handled.
All right, Leon, would you like to connect to Dixon or anyone else who wants to talk about this, maybe on email? Would you want to share how best to connect with you for further discussion?
Okay, no problem.
Sam,
we can still meet up on the forum, on the community. Thank
Great. You. Yeah, that sounds good. So thank you. Anthony, you had one more thing?
No, I was saying we can have that discussion on the forum because we have an issue on that on the forum.
All right, sounds good. All right, thank you so much, everyone. This was great. Thanks for the discussion. Thanks for the presentations, and looking forward to seeing you in the next one. We'll be sharing the recording and the notes right after this, or in a few hours. Thank you. See you.
Everybody.